Let's go ahead and get started. I have 1 o'clock on my screen here. I know we still have people trickling in, but we'll do our best to keep it, be respectful of everyone's time. Let me introduce myself. I'm Corey Atkins. I'm the Vice President of Public Policy and General Counsel for the Asheville Area Chamber of Commerce. Welcome to the next in our series of industry town halls in conjunction with the county. This particular one is focused on lodging. First, before we start, let me express appreciation for the level of collaboration that we've seen throughout this pandemic between both the public and private sectors. It's one of the silver linings really in this moment, and the town halls we're holding like today and tomorrow and yesterday are another example of how we've worked together and how we continue to do so. So let's talk a little bit about, for those of you who are participating today, about what this meeting is and what it is not. This meeting is about giving the health department of Buncombe County the opportunity to listen to business owners about your ideas and best practices around safely conducting business as we continue to deal with COVID-19. It's also a time for them to hear about the things that you haven't figured out yet, whether it's where to obtain masks, shields, or gloves, or how to ensure safe social distancing is accomplished, or any of the other host of issues that business people have to deal with when operating during this coronavirus pandemic. What this meeting is not a time to lobby the health department about whether or when we should reopen or not reopen. You're not going to come away from this meeting with a deadline for when you should prepare to reopen either. So I want to set that expectation now. But what you will get is a better understanding of how those decisions will be made. Today, we'll hear from Fletch Tove, Public Health Emergency Preparedness Director of Buncombe County. Thank you, Fletch, for joining us. Then we'll ask representatives from the industry. In this case, we have with Vertel Hospitality joining us. Thank you, Himanshu, for being here. And really join us as conversation starters and anything else. Can you please mute that person? Thank you.
All right. Shush.
You got technical problem. Yeah.
Okay. Now we're good. As I said, though, we're also joined by Himanshu Carver from Vertel Hospitality. Thank you, Himanshu, for being here. And Himanshu's really here, past chamber chair, incoming TDA chair, to really be a conversation starter for us and help spark ideas or questions that you want to pursue. So we'll ask a series of questions, and we'll ask that you respond in the chat feature. We're recording these sessions, and we'll be asking you to make use of the chat feature to give your input. That will allow the health department to have a literal record of what you've said. And we're doing 7 of these in 2 days. So it's important that the transcript of the chat feature go into the record, and it certainly will help us going forward. In addition, we're going to be working on publishing a frequently asked questions document, FAQ document, if we can't answer all the questions here today in this hour time frame. On these slides, we're going to ask the attendees who are watching here today for their ideas. And we really encourage you to please not be shy and type in your ideas and questions, as they're really important for the county and us to get that feedback. We're curious to know, what's helpful and frustrating for business owners. So please share your feedback via chat before you leave the call, even if you didn't have a chance to have your question answered. We hope by doing this, we can identify any community-wide barriers that we need to address, that the health department will have a better context for decision-making about businesses reopening, and that you, as the owner, can start your preparations for reopening so that you're ready whenever that day comes. I want to let you know that we're here collecting ideas today, and that just because we discuss an idea and like it doesn't guarantee that it's the way it's going to go, because in the end, it is the health department's responsibility to determine which ideas provide adequate safety and not ours as much as we might want to. With that being said, let's go ahead and get started, and I'll introduce next Fletch Tove, Emergency Preparedness Director for Buncombe County. Fletch, thanks for joining us.
Hey, good afternoon, everyone. I appreciate you being here. So I want to start off giving everyone a snapshot of where we are in the state and in the county. So last week, Governor Cooper and Dr. Mandy Cohen gave us the guidelines of some metrics they're monitoring to determine when is the best time for us to start our reopening process. They also laid out a 3-pronged approach on our roadmap to a new normal. Those 3 prongs they're talking about are increased testing, more capacity for contact tracing, and downward trends of those metrics they discussed earlier. And that led to Governor Cooper's first iteration of his phased reopening plan, looking at 3 phases. Phase 1, once we meet criteria, will start and go anywhere from 2 to 3 weeks, ideally. Phase 2, we'll see some increased openings, him suspending his stay-home order and opening up some more retail, and that's scheduled to go anywhere from maybe 3 to 5 weeks or 4 weeks. And then the next phase 3, opening up. So I want everybody to be in the mindset that as we're talking about this situation, this isn't a May problem. This is a May, June, July slow opening we're looking at. Because even if we meet all the criteria we're discussing and all the data looks good, best case scenario, phase 3 is going to be sometime in July. So this is a kind of into the summer opening sequence we're looking at. Locally, to meet those 3 prongs of increased testing, we are seeing increased testing slowly but surely up here in the county as we get more resources and more providers coming online offering that. For contact tracing, we're developing a team to respond to that. And once the state pushes out its statewide training and platform, we'll be able to quickly respond and increase our capacity for contact tracing. Just so you're aware, we're currently doing 100% contact tracing on all positive cases. And then for those downward trends, we're trying to distill the state data at a local level, use the same metrics they're looking at with local data to make sure we're aligning there. Intentions going forward is to align with the governor's guidance as much as possible. So over the next couple of weeks, that will mean we're going to relax some of our more stringent restrictions locally to kind of more align with that going forward into his phased reopening. And just want to reemphasize that we're aware of all the impacts and secondary impacts of the decisions we've been making over the last couple of weeks. They're part of every conversation we have as we develop our policy. And we know the sacrifices that both small independent business owners and other businesses have made over the last several months. And we don't want to waste those sacrifices by moving too fast and getting ahead of ourselves and having a big resurgence of the virus, the disease locally. So we're really focused on having a slow and deliberate reopening process based on data. And that's it for my update.
Flash, just a quick follow-up. You mentioned the 3rd phase of guidance from the governor. Is there any indication whatsoever, and I know we talked about there not being deadlines, but of when we at least know there might be a plan coming out, whether or not there's not an exact date set, but at least we'll know that there is further guidance from them on that.
Right. So last week he gave his generic plan of the 3 phases and the timeframes they'll be allotted for. But the initiation of that process is based on those metrics. It's a series of metrics of like how many are trending positive cases, our PPE stockpiles, our contact tracing capacity, some other things the state's looking at and we're looking at locally. So when we, hopefully this week or next week, we get some more specifics from the governor about what is actually entailed, the nuts and bolts of those phase 1, 2, and 3 levels. And then we'll also see as when we hit that criteria to start in phase 1, that's going to set the rest of our timeline. But it's always going to be data driven. So he might have phase 1 as going for 2 to 3 weeks, but if the data is not there to support going to phase 2, we might be in phase 1 for maybe 4 or 5 weeks until we hit those benchmarks that they've set.
Right. Any idea where we're at in that spectrum, as in Buncombe County specifically?
Buncombe County, we look pretty good on most of the data. I don't have it in front of me, but we would like more testing capacity. We're seeing that slowly ramp up. Our contact tracing capacity is there, and most of our trends are flat or down But I mean, that doesn't necessarily mean we're ready to reopen, but locally our trends are looking good. But we also have to keep in mind, he's looking at it as a statewide, as a varied state. We also have, neighbors on all sides who are very aggressively reopening, who are seeing surges of their own cases, who are setting records this week alone in their number of new cases. So we're watching very closely as Tennessee, Georgia, and South Carolina reopen, what impact maybe that has directly on Western North Carolina, and then independently for those their internal numbers, what their trends start to look like. And I'm sure the governor will be watching that as well to inform his decision-making process.
Okay. Thank you, Fletch. Really appreciate it. Thank you for staying on the line, as I'm sure we're going to have a lot of folks in this room with a lot of questions, especially as it's geared towards lodging and hotels and the like. Up next, I believe we have Felissa Vasquez, who's the Environmental Health Supervisor for Buncombe County, to talk about some preparedness and preparation for getting ready to reopen. Felissa, please.
Hello, everyone. Just wanted to start off by letting you know that our staff is available to perform either virtual visits or training, and also to do in-person visits as long as we can maintain social distancing during those visits. And so we can perform, we can do training on anything from how to properly clean and disinfect. Also, if you provide food service, we can walk you through how we can reopen that part of your business as well. We also have some resources available, and we can provide you some links. There we go. Thank you. Those are really helpful. The first one is the state resource, and it also provides you some up-to-date information with the governor's executive orders on that site, and what to do if you do have an employee who is either suspected or confirmed of having COVID-19. Additionally, we can help you develop or implement an employee health hygiene policy. And we also want to talk about your water system. If you have been closed, making sure that you're properly flushing those out before you ramp back up for business. So we're available to help, and we're here as a resource. And you can schedule those visits or request additional information at ehrequest@buncombecounty.org. And I've also provided the phone number there.
That's great. Yeah, thanks, Felissa. Those are really great resources. And if someone wanted to get in touch with you directly, are they able to do that for their particular business, to say, hey, I'd love to set up one of these virtual meetings and let's do the rounds and make sure we're doing everything we need to do to safely reopen?
Absolutely. So I feel like almost everybody has my cell phone number these days, and I don't mind anybody using it. And I do have the main line there, which is the 828-250-5016. And then that is staffed throughout the day, so somebody can answer that that phone and then get you in touch with the inspector over that establishment. And I'll also point out, if you've ever struggled with anything, you've got a little bit of downtime, we can also cater any of the training to your needs, and we can do that virtually through either a Zoom meeting or Teams meeting. And so it's a good way to get employees all on the same page before you open up too. So we're happy to do that.
All right, thank you so much for that. And we'll be sure to share this with folks afterwards. Yes, I saw those questions. We'll definitely make sure you have access to all those resources as you need. Okay, up next is one of our industry partners that we really want to help start sharing some ideas. And again, continue, I see some great chat going on. Please continue to keep doing that in the chat. Get your questions and ideas out there. And we're going to hear first from Himanshu to really start off a conversation about strategies and things we can do to help benefit a potential reopening. And Himanshu is, of course, with Vertel Hospitality, small business owner, been involved in the community for a very long time. And with that, Himanshu, I'll be happy to turn over the floor to you.
Thank you, Corey. Good afternoon, everyone. And so like Corey mentioned, so this is Himanshu Karveer, and I am also part of North Carolina Restaurant Lodging Association's NCRLA's COVID-19 Recovery Task Force. So that's looking at making statewide recommendations to the governor's office as we look at reopening restaurants and hotels, lodgings, and such. The difference for us here is we are, like Fletcher mentioned, we are unique. Our county is unique, so we have to tailor our everything we do here for our county, which is the right thing to do. I also want to mention that we have 4 existing hotels that are operating currently, and we use county resources on coming and doing training for us, for our staff on 2 of those hotels. And they've been fantastic to work with. They've gave us recommendations on cleaning. They've talked to our housekeeping staff to ease some of their concerns they might have had. And so I would encourage you to look at what they have available on their website and then use them as a resource. The also interesting thing is we have some hotels that are still operating, some lodging facilities that are still open, while some are completely closed. So when reopening means different things for everybody. But I am, if you go to NCRLA's website and look at COVID-19 information, there is a document that specifically talks about after the COVID-19 pandemic, planning now for the return to occupancy. It's a 10-page document that goes over what it would look like to reopen your hotels or your lodging facilities for business. It gives good information, which we're already doing because as I said, we're already open and running. But some of the information that's on here is, which I found interesting, is social distancing. Obviously, we're doing that. That's mandated currently, but how that looks for as occupancy increases and we have more staff coming in, what does social distancing look at? So staggering of employee schedules, limiting interactions between departments. If you have a sales team that can work from home, still allow them to work from home. Looking at pools and gyms and how to clean those and how to keep them sanitized. And the other thing I also want to mention real quick to the county staff is most of the brands, for example, Hilton, IAG, Marriott, Choice, Best Western, even Airbnb have come out with guidelines on how to clean rooms and how to, what chemicals to use. Hilton just launched yesterday a partnership with Lysol on disinfecting rooms. Marriott has done similar things, and so is IAG, that's Holiday Inns, Holiday Inn Expresses and such. So most of the large brands already have cleaning standards in place that brands are supposed to do, but this would also go for Airbnbs or short-term rentals and for bed and breakfast as well. As far as specifics go, I think some of the things we've mentioned or we've done in our hotels is put up those plexiglass barriers at check-in, just to have distance between our employees and our guests checking in. We have also marked spots for 6-foot distance. We've got signage posted everywhere, at least right now in 2 languages, in our elevators, in our check-in areas, in our public space, in our guest rooms. We're letting guests know about not only our county's restrictions, but also what social distancing and all that stuff that goes with that. Some of the things as we look at, again, opening up is, we've heard a lot about taking temperatures of employees as they come in. I guess that would be at some point, the county would decide something like that if that's what's mandated for us to do or not. So I'll leave that up to the experts. But like I said, NCRLA's website has a great guide on looking at different things, and I'm going to it's hard to read, I get it, but this document is available. You don't have to be NCRLA member to get this document. You can just get to the website and download that information, and it goes over PPE, what's required. There are some great resources here locally that a lot of manufacturers are converting their operations to manufacturing masks and shields. We are using those resources right now. We've placed orders for that for our staff, and those are coming in. So there's a lot going on already. So that's where I am on that. I don't know if you guys wanted anything more specific than Fletcher or.
Yeah, let me touch on the screening real quick. So, well, first of all, physical distancing and use of face coverings are probably going to be with us for the rest of the year and into next year. But for screening, as you look to reopen or as you're doing that, screening your staff on a daily basis is a best practice. And that screening, it should be questions about symptoms, how they're feeling, and we could provide some resources for that. And it doesn't have to be very long, just general questions about whether they're feeling feverish, what the symptoms they've been having. As far as taking temperatures, if you have the resources to do that and you can do that, but there's a couple of things to understand. One is that temperature taken alone is not sufficient. You have to couple the temperature taken with the symptomatic screening. Two, 50% or possibly even more, upwards of 75% of people sometimes might have COVID-19 but not be displaying a fever. So we're going to miss a lot of people with that relying on the temperature screening. And the concern is it's going to create a false sense of security where people might say, oh, well, I'm feeling like 2 or 3 symptoms, but I just took my temperature and I'm only at 99, and have this false sense of security. So we want to stay away from that. Some things we've seen some other industries and businesses doing is actually having employees and staff, as they come in on a daily basis, fill out on paper like a short screening questionnaire. Some more advanced options are having an app that actually prompts them the night before they report their symptoms. We've even seen some people kind of doing a social contract that says, as you come in and clock in the work today, you're stating that you're symptom-free and don't have, any concerns about your health. And so there's just a spectrum of people we've seen that doing that screening. So to summarize that, screening as we reopen or for your staff is a best practice. We recommend everyone do that. The temperature check parts, as public health, we're not saying don't do that, but it's the more important part is the questionnaire, not getting the temperatures.
Yeah, that's great. And thanks for that insight, Fletch. And thanks for your ideas, Himanshu. That's awesome that you've already utilized the county resources. It's very forward thinking. I think that's something everyone should do. In addition, you mentioned the guide. I've shared the link, and I think someone else did on the chat. So anyone who's watching should be able to get a link to the NCRLA guidance. Thanks to our friend Jane Anderson at AIR, who shared that with me earlier via email. And we'll also be sharing that with our restaurateurs here at 2:30. So make sure you utilize that as possible.
Well, can I say one more thing real quick? The
Sure.
other thing I've seen in the industry or people have discussing or have questions about is as we open up for lodging, even now, checkouts come in, or checkouts or how the rooms are cleaned, whether to keep them empty for a certain number of days. And I'm trying to do some research on that, but the best practices I've heard or I've seen is if you're following CDC guidelines on cleaning and you're using the right chemicals, you can clean, and you have the right PPE for your employees, you can go in and clean those rooms as they're checking out, or you have to keep them 72 hours before you can go into those rooms and clean them as a checkout. The other thing we're looking at is also the cost of doing all the things, because if you're adding little things here and there, PPE, temperature checks, questions, you're changing procedures, you're adding training hours, you're adding chemicals, you're adding cleaning. The cost of this adds up pretty fast. So just keep that in mind. And, Fletch, you mentioned about PPE and requirements till the end of the year. And I think that would encourage the county to continue to think along those lines about some of these restrictions on when they sunset or when they have an ending date, so that we are not continuously incurring those costs of operations if we don't need to. That was the other couple of things I wanted to mention.
Right. Take a second real quick to talk about something I mentioned to all the other town halls we've been doing to clarify some questions about masks. So we're being very deliberate when we use the term mask versus like a cloth face covering. Masks and medical grade PPE, surgical masks, N95 respirators, there's still a scarcity and there's still supply chain issues for the nation on those. So we're really encouraging, and what our guidance says and what the governor's guidance says and what the CDC guidance says is encouraging people to use some kind of cloth face covering. So that could be everything from like a bandana or like a t-shirt that's folded over with rubber bands, and there's guidance for that online, to like the hand stitched ones you're seeing a lot of people wearing. There's a couple of benefits of that. One is if people are using those, it's going to decrease the draw for first responders and medical professionals who need the true PPE. And two, they're long lasting and washable. So if you get 2 masks like that, you can use one day and wash it and use the other one, and that'll last you for weeks and months for the duration of this. If you're using the other mask, you might be able to use one for a week or so, but it's going to degrade, it's going to lose its form and integrity, And as a nation, if we start doing that, we're going to run through our supplies of true PPE again that we need for first responders. So we're using the cloth face coverings, and it can be a scarf, a bandana, something stitched at home, but those are far recommended for those reasons.
Great. Thank you, Fletch, for that distinction. Moving on, we'd love for you all that are watching here today to please share your ideas and strategies that you could benefit or that you're using or that you think could benefit your industry in reopening. I encourage you to do that in the chat box now. But while we're looking through those, Fletch, we have a question. Is lodging considered a phase 3 business, quote unquote? Are there categories in each phase? And if so, are hotels, motels, and B&Bs lumped in with STRs in that group?
Right. So I think the governor's initial guidance that he's given is pretty generic. We just saw, some slides with some bullet points. What we're hoping for and expecting later this week or early next week is to have those fleshed out for more detail. So I would expect that they would understand the nuance between those different lodging industries and have some guidance accordingly. But that's a discussion we're having. And as we get that guidance from the state, because we're really trying to align with the state moving forward, we'll incorporate that locally. So I think, they're aware of the nuance between these different kinds of lodging entities. I see some other questions about timelines. Again, the governor gave out his ideal phases, but it's going to be data driven. So as we get more description of what the individual phases will look like, it might give you a better window of what your reopening opportunities might be like. But I don't think, unfortunately, we're ever going to be able to set a date, because it's going to be until we get into phase 1 and see the data trends and can say like, okay, next week we'll hit that 3-week mark. We're not going to have that kind of stuff. It's going to be like windows of opportunity for us moving forward.
Do you, what are the current numbers in Buncombe County? I don't know if we said that earlier.
Like case counts?
Yes. Mm-hmm.
I saw Ellis Vaughn posted that up on earlier in there. I believe we're at 54 cases with 4 deaths as of now.
Okay.
And as far as phase 1 begins, we're not necessarily sure. It starts on May 8th. We're waiting for some guidance from the governor. Part of the criteria was 14 days of decline and 14 days of certain metrics, and we're not going to meet that by May 8th, but we're not clear if that necessarily means we're going to phase 1 on May 9th, or we're going to have to hit that 14-day window first. That's some of the guidance we're waiting for from the state.
Right. How much collaboration? Go ahead.
Go ahead. I was going
to say, has there been collaboration going on, or are you aware of with other tourism communities in North Carolina, maybe across TDAs, maybe across county to county? Are you aware of that kind of collaboration going on to discuss these phases? I know there's communication going on with the governor's office via some of the statewide associations who have pretty strong lobbying impact. So are you aware of those county to county or tourism community to community sort of collaboration?
Right. So let me talk to you real first about what we're doing locally. So okay. Just as we're having this town hall, we're having 9 total this week with different industry sectors. So that's where we start, getting your guys' input, your ideas, you seeing what kind of issues you're seeing, but also what kind of ideas you have to reopen, and we're taking those into account as we look at our policy. I know like the Chamber and Explorer have their networks they're contacting with. I know between health departments, we're looking regionally, between emergency management, we're looking regionally. I know everyone here, the county and city have their business development teams, and they're contacting with the state and the region. So that coordination is underway, but you have to keep in mind, every county has its own jurisdiction. So they might have different strategies or different ideas. And that's why we're looking for a really strong, comprehensive, cohesive strategy from the governor to kind of give that blanket guidance.
Yeah. Another thing I'm curious about, and as you guys continue to ask questions and share your ideas, let's think about what resources do you think are needed currently? I really think that, I know we're asking a lot of questions about timelines and deadlines. And as I said earlier, that's just not going to happen throughout this chat. This chat's really about giving feedback to our county experts who are here today, as well as sharing ideas amongst each other in your industries about safe ways to reopen and things you're thinking about reopening. But I'd love to hear more about what resources you might need, whether it's access to PPE. Obviously, everyone's looking towards trying to keep some kind of funding in place, keep folks employed as much as possible during all this. And so I want you to think about that, things that you know are coming in the pipeline or that you've already found that you need while trying to stay open. We do know there is a question I think pretty pointed, Fletch. Does phase one begin when the current order expires, which as of right now is May 8th? I know you touched on that, but do we know that for sure yet?
Yeah, so we don't know for sure. What the governor seemed to imply is that we have to hit those 14 days of the certain metrics, which we're not at right now by May 8th. But we don't know if we're looking for some clarification. We're not sure if he meant go on May 9th to phase one and then start that. But we're making the assumption that we have to hit those 14 days of metrics, but we're not sure.
Would you recommend that hoteliers, everyone here who's part of the lodging industry, ask questions? So the questionnaire that you talked about earlier for employees as they come in, would you recommend them doing the exact same thing for their guests who may be arriving? Yeah,
we're you guys should be now, as people come in for essential travel to your businesses, be screening to make sure, asking them the guidance if they're coming for essential purposes. So I think there'll be something similar like that. We're curious to see if the governor has some statewide guidance on lodging like that, but we'll probably continue to ask, people to ask where they're traveling from and if they're symptomatic. We're having those discussions now. I do briefly want to touch on Kathleen asked if we're taking into account the troubles, mental health, and everybody's going through as we go through this whole situation. I just want to reassure you guys that since the onset of this, we're acutely aware of the impacts and secondary impacts of our decisions on the local economy and independent business and even big business. And every conversation we've had from the get-go, that's a major factor that in discussion. So every decision we're weighing, mental health, financial impact, secondary financial impacts are all part of those discussions. Just want to let you know that that's in the forefront of our minds as we move through this decision-making process.
Yeah, it's extremely important. And I'm going to hit on some resources. I know that Ellis was very timely in posting in this chat. I encourage people to check out through the CDC. Also go to the county's website. But, at the chamber, we've done our best job trying to compile as many of these resources, including the things you mentioned, on our website at ashevillechamber.org/coronavirus. Not only is it a business resource, I think it's an employee resource. I think it's a place to go watch some of these, some of our virtual town halls and things. I would encourage people to keep try to stay as up to date as you can. I know there's a lot of information out there, but really try your best to stay on top of that and do your best to keep your employees informed as well. There's been a number of questions about the governor's view of some sort of phase reopening plan. Is he looking statewide? Is he looking community by community? There's been talk of him maybe doing a regional approach to this. Do you have any insight as to that, Fletch?
Yeah, so the language he's been using right now, it makes it seem like it's going to be statewide. But, as he looks at other data and sees what's happening around our neighboring states, he might modify that. But unfortunately, we don't have much more insight than that general plan right now.
Do people need to keep documentation on file if someone's an essential traveler? To me, I think that would be on the individual, correct? Not necessarily on the lodging.
Right. So some of you guys have been on the lodging calls we've had with Explore Asheville, and they've given those resources. They created a standard template for that. So we had recommended that as you ask those questions, either to use that form or keep it documented in some manner, just so if there is an issue, you can show that you made your best efforts to determine their reason for travel. And as far, I see a lot more questions about timelines and planning 6 weeks out and reservations in May. Again, unfortunately, we're my best answer for you is hopefully this week the governor gives some more specifics on what those actual phases will look like. And then once you get those level of details, we can start having a conversation and we'll assist with this, but looking at what potential windows look like. Because again, the dates the governor gave for each of those phases are assuming best case scenario. If phase 1 gets delayed by 1 week or 2 weeks, that might mean, phase 2 and phase 3 also get 2 weeks or 3 weeks added onto them. So it's really hard to give you guys any kind of timeline right now.
Yeah, and I think that goes to our next slide, Fletch, talking about gaps in the current guidelines. I know everyone is very anxious to know when. But what are the other gaps that folks are hearing about or think exist? It seems like there might be an issue there with distinction between B&Bs, motels, hotels, and perhaps short-term rentals. That's definitely one I'm seeing pop up a lot that we might need to address. But are there any other gaps folks feel like they see in the guidelines they're not sure of about what to do going forward outside of the timeline, which I know we're really all concerned about? Is there a policy currently in place on short-term rentals in Buncombe County, Fletch?
Yeah, so currently short-term rentals can be open only for essential travel. We've asked people to cancel and not book any leisure travel, and that's part of the reason we're asking people to, inquire from people and document that. Also, as of now, we still have the policy that people coming in from out of state for non-essential travel need to be quarantining at their residence for 2 weeks. So that was partially to address people coming to second homes and summer homes and vacation properties they own. But also if somebody's coming to an Airbnb or for somehow gets in without not being essential or a hotel, if they're planning on coming for a week or just a couple of nights and it's non-essential, they need to be quarantined in their rooms for the duration of that period. Yeah.
And Kathy Peterson just shared from CVB stay-at-home regulations for those folks. Let's see, the
Thanks, Kathy.
documentation form, excuse me, is on their website through that link. So thank you, Kathy, for sharing that in the CVB. We also had some contact with our partners at Explore Asheville earlier as well, Fletch, and something that kept coming up is, I think Himanshu touched on the nationwide standards that the major hotel chains are coming out with, sort of using those as baseline best practices. I think we talked some about that. Has there been any thought or put in place about the possibility of a second closure? I know that seems like so far down the line, and we're so worried right now about putting guidelines in place for reopening and trying to get the economy back on track. But has there already been thought about a second closure, when that might occur, and getting things sort of prepared for that and being more prepared this time around?
Right. So let me real quickly, before I get to that, I see a lot of questions about different kinds of lodging. I just want to say locally, and I assume very much at the state, they're aware of the nuances and differences between like a short-term rental, like an Airbnb, versus an Airbnb or a bed and breakfast versus a hotel, small, motel of all the variety. So that's definitely part of our planning process. I want to assure you guys of that. We're aware of the difference of those. As far as, potential of a second wave, as the nation starts opening up, we know we increase testing, we're going to see more positive cases. We know there's potential for another surge. We've been pretty fortunate in North Carolina that we haven't seen this first wave start overcoming our capacity, our healthcare system capacity. But that doesn't mean if we're not responsible and being slow and deliberate when we reopen, that won't happen later in the year. There's any epidemiologist or virologist will tell you we should anticipate some second wave as we start reopening, start anticipating something in the fall. We know that COVID-19, when we get into normal flu season, on top of that, is going to put increased strain on our healthcare systems. So these are all things we're planning for, but we're hoping is if we do things right and we're deliberate, slow, and data-driven, that we won't be put in a position where we have to have a severe lockdown again, like we did with the stay home, stay safe. What we might see though going forward is, getting the phase 1, phase 2, phase 3, and then having to revert back to maybe phase 2 for a couple of weeks. And And that's what it might look like for the rest of the year is incremental step downs as we see that surge capacity jump up.
Yeah. That makes a lot of sense. And yeah, would hate to see another complete shutdown, but I think we have to do what we have to do in light of the circumstances. So yeah, I mean, I think that we have addressed a lot of those concerns about sort of in your answer, I think really gets to if there is a phase standarding into or standardization of how we get reopened. If we know another wave's coming in the fall or in the winter, ways to sort of back that down gradually, but still having a lot of these safety precautions that we have in place. There was did we address this question? I think we did, but David's asking about as far as the gap in guidelines, what phase lodging is considered in those guidelines?
Right. So from the governor's guidance, I did not see specific reference to lodging. So that's, one of the questions we have. And as we look for him to get, he was just laying out his strategic plan moving forward. We're expecting to see in the coming weeks is the more tactical details of how that actually applies to different sectors, what phase one would look like for lodging, what phase two would look like for lodging. So we don't want to get ahead of them and start making assumptions locally until we see what the state plan is. But I would assume, as with the other industries, some aspects will open up with each phase. So I don't think it's going to be like phase two's go time. I think it's some things would be available phase one, some phase two. But I think phase one is going to be small and incremental. Phase two in general, he's going to suspend the stay-at-home order and change mass gathering guidance. So I think phase two is where we're going to see the biggest shift we'll see between phases.
Yeah, that seems to be my interpretation too, Fletch, just looking on the outside. But certainly we can continue to interact with the governor's office and with our local delegation to try to get more guidance and get more clarity on that for everyone here. I think it's appropriate talking about resources. The NCGA, the General Assembly, went to session today about an hour and 40 minutes ago officially. And they already have some federal money in the coffers waiting to figure out a plan to disperse that money. Locally, we have a lot of that at stake, of course, both for our municipalities, our county government, but as well as our local small businesses. And so we're certainly tracking that as closely as we can. We've been heavily involved in the economic working group that was a part of that, and have some delegation that are involved in that as well, that are on that committee, I should say, rather, on the House side. So I think you'll see the governor came out with a plan yesterday or day before yesterday, talking about $1.3 billion he's looking to put into the economy and to help out our health and safety workers as well. So we're certainly tracking that. Hope those resources come and we get an even share out here in Western North Carolina, especially here in Buncombe County as the engine of Western North Carolina. So we really want to see some great things come out of that. And we'll be lobbying, as hard as we can from a distance, obviously, but talking to as many of the decision makers as we can to try to help out and get the resources that all of you need and that our government needs to continue to provide services for everyone. I believe we can go on to the next slide. If we didn't address your question today, if you have closing thoughts, feel free to stay on this chat and log them. Like I said earlier, we're going to have an FAQ document at some point, but we're also sending the transcripts of these chats to the county so that they can log these and have this information. You can certainly email more thoughts and questions to that email address you see there on the screen. It's business@buncombecounty.org. In addition, a lot of you answered our first phase survey that we did when COVID-19 lockdown first started to ask you about the impacts to you and your business. We now have a second survey that's out there to continue to think about, if you have thoughts about how the recovery has been to this point, have you changed what you said in the original survey as far as what resources you need and your procedures for deciding to reopen or not, or keep your employees employed. And so I would encourage you to please go to ashevillechamber.org/coronavirus and complete that second survey. It'll also help inform us from a policy standpoint, as really that's what's in my wheelhouse, to think about where are the gaps and holes that we need to fill, what are the issues, whether it's unemployment insurance, whether it's business insurance issues, whether it's SBA loans and PPP program, and whether it needs to be more streamlining of those kinds of things. Really would like to get that feedback and have that data to share with them going forward. We appreciate you completing it, and we will be presenting that information again to all policy and decision makers for input. Certainly, as we go through all of this together, we have to be together, because together we're definitely more resilient as a community. We can face this. And thank you for joining us all today. Thank you for sharing your collective wisdom with us today. Thank you to Himanshu, Fletch, and Felissa for providing their expertise and their input. And thank you to all of our partners in local government on this call and elsewhere who are working to help us keep us safe and healthy. Again, thank you all for your input, and hope everyone has a nice day. Thank you.
Thank you.